what brings you in today?
Yeah, this pain and this back pain here. Just keep bothering me. Like what years ago, I jumped down off a place and left my land bad.
How long ago was that?
So it's like around 3 years ago now.
Okay. And you've had back pain ever since?
Yeah, it just started, but yeah, it started bothering me ever since. I pain me like sometimes I move it's like, I move it hurt.
And it's
even
always
lay down, yeah.
Always on the right side?
Yeah, always in this square, always in this right side.
Have you done any treatment on it before? Have you done anything with it?
No, I didn't. No, I did nothing to it.
What makes it worse? What if it's been getting progressively worse? Anything?
Yeah, it's getting worse. Most like it's been a lot. It's worse, you know. It hurt me worse.
I see your work as a roofer.
Yes.
Has it stopped you from doing your job?
Yeah, it kind of slow me down from doing my job because sometimes I do the job, it's kind of, it's difficult. It's difficult. It's bothering me more.
Is it worse at the end of the day or is it worse during when you start?
Most likely at the end of the day, I might be doing after, but most likely at the end of the day, it's mostly bothering me more.
What about sleeping at the end of the night? Does it stop you from sleeping?
No, it don't really stop me from sleeping, but like sometimes when I can sleep and like my move, like my turn.
Right, you feel it. Yeah. And it's always on the right side. Does it ever radiate down the legs at all? Or does it just stay in the low back here?
It just stay in the low back.
Just stay in the low back.
Yeah, sometimes it's just like from here, like you get a burning sensation from here.
Alright. No pain medication? You taking Aleve, Advil, nothing? Alright, let's get started. First part, when somebody comes in, they have general low back pain. Like we're having here, and there's a history there. Like this one has been going on for 3 years,
yeah.
And it's a lot of people. Like I get busy, I don't have time to take a look at it, and I expect it to get better.
Yeah.
But then progressively gets worse, which can suggest a couple of things. It can be a disc herniation, but I'm not really thinking disc herniation because it's not radiating down the leg. I'm thinking like it's your pelvis. I'm thinking right now it's where your hips and your tailbone come together, right on the right side. That's what I'm thinking. It's because sometimes it can be good. And then sometimes it can be really, really bad. Yeah? And that's what I'm thinking. Yeah. So do me a favor, cross your arms across your chest. Stay just like that. I'm gonna roll you down. Tell me if you have any pain or discomfort with this at all. Relax, 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 relax. Any pain or discomfort?
No.
No. But you're guarding a little bit. Let's go on that same side again. How you doing there? Turn this way. Now lean down towards the table.
Oh yeah.
Yeah. Right. Yeah. Right. Does that hurt right there?
Yeah.
Got it.
Yeah.
Right
yeah,
there.
Right there.
Right there. Right there.
Yeah.
All right, come on.
Right.
I'm gonna help you up. I'm gonna help you up. Do me a favor. Cross your arms again. We're gonna do the same thing on the other side. We're just gonna test the other side. Relax. Rock. No, not as much on that side.
No, that's
so obviously we're doing lower back. It's more so on the right side. Yeah. The left side is wide open. So I'm thinking we got spasms and pelvis issues right here in the lower back. Let me help you up, sir. Do me a favor. Lie your back for me, please. Face up, okay? So this is the part of the examination which we call orthopedic testing. Yeah. This is the part where we're trying to get an answer. All these movements tell us something about what's the source of the problem. We're definitely gonna have to do x-rays. We're definitely gonna have to do x-rays to check to see if the pelvis is lined up or if there's damage to the low back that we don't expect that's there. One of the tests to determine if you have a herniated disc is a straight leg raise. Just by lifting the leg up in the air, if that were to act, and this is really good. That's really good, actually. Bradley's in pretty good shape. I'm gonna tell you that right now. Bradley's in pretty good shape. From his heart rate to his blood pressure looks good. Physically, I mean, you're keeping yourself together. Even his flexibility on this right leg is excellent. If he had a herniated disc, it would be hard to do that because these muscles attached to the back around your pelvis, it would stretch out the nerve that's going to be aggravated with a herniated disc. So more than likely, at this point, we're thinking it's probably not a herniated disc. All right, tell me if any of this hurts or bothers you at all. A little tight in the front of the leg?
Yeah.
All right.
Yeah.
Is it hurting the back at all?
No. Yeah, this
Only the front of the leg or also in the back?
Yeah, we can feel it in the back too.
Right. All this is pointing toward. Tell me if you have pain or discomfort right in here.
Yeah, right there. Yeah.
All right, right there. That's
right
pelvis.
there. That's the spot right there.
That's SI joint. Now tell me if you have any pain on this left side.
No.
No. Why you shouldn't wear your wallet in your back pocket while you're sitting down? When you wear your wallet in your back pocket while you're sitting down, it's creating imbalance in your pelvis. So basically, your pelvis with the wallet here is going to be like that. So when you're sitting down, make sure you take your wallet out of your pocket.
Okay, let me hear this story. I watch YouTube or something.
You saying the same thing on YouTube? YouTube, the new encyclopedia. Tell me if I have pain in the stomach there. You're there? You okay there? You okay there? It's just hot down here. Just hot down there. All right. Come on up, sir. All right, what we're gonna do next is we're gonna take X-rays. We're gonna make sure it's not a herniated disc or a pelvis issue. So we're leaning towards pelvis issue, but we can confirm that with X-rays. Right now, we know it's low back. We know we're dealing with tight muscles. We know we're dealing with spasms. So at this point, anytime he puts weight on that side, it's going to cause more pressure, and that's why it's getting worse, because the inflammation is getting worse. So our goal at this point is that when you walk out of here, that you're feeling better.